Okay, please, I'm actually very, very sorry for all these shows that's going on. The devil is a liar, we must continue. Because a lot of persons have actually indicated interest in this very topic we're going to be discussing. So I'll make sure we actually give it our best and the knowledge will be passed. Please help me assess the audio quality. Please, if you are getting the audio quality very well, can you just signify and tell me I can hear you? Go ahead. Okay, so what we'll be talking about today specifically is about prostrate. So we'll be answering some questions. We'll be answering some questions associated with prostrate. But it's very important for us to know the main reason why we are here. So the main reason why we are here is to know how to survive prostrate, how to survive prostrate enlargement without side effects. Okay, so thank you so much, Johnny. Thank you so much for everything. Thanks you for your feedback. So now we can actually progress to our conversation. So we are starting from the top. So what we are going to be discussing today is how you can actually survive prostrate enlargement. Surviving prostrate enlargement, it's very, very easy. Okay, it's not a rocket science stuff. So one of the things that you need to have in mind is early dictation. But before we now go into discussing all the things, before we talk about the things that you actually need to do to be able to handle prostrate issues, so that you don't in a way you can't handle, in a way you will survive it and you come out without side effects. It's very, very important that we actually understand what prostrate prostrate is, what prostrate enlargement is, what causes prostrate enlargement, and how someone can actually know that they have prostrate enlargement. Then how can this person be able to do what, to cause prostrate enlargement without having any issue. So prostrate is actually a gland of the male reproductive organ, male reproductive system, meaning to say that a female cannot have prostrate enlargement. Okay, so prostrate enlargement is specifically for those who are identified at birth, okay, or those who are ascribed, or those who are identified as male at birth. Okay, you know we have different gender available these days, so we have to put things in their right perspective. So those identified as male at birth, they are the ones who have prostrate, and this prostrate is actually um, of the male reproductive organ, of the male reproductive system. So now this prostrate is very, very small. I did an example like as small as this, and is located after the bladder. You know, the bladder is actually the place where urine is stored temporarily after it has been produced by the kidney, up there temporarily, and after it passes through the ureter to the exterior. Okay, so having said that, this prostrate we are talking about is seen after the bladder, and this ureter that actually conveys urine outside the body is actually located, is actually passing this prostrate we are talking about. So I give an example. This is the ureter, this is the prostrate. So the ureter passes through this to be able, for you to be able to see it. Like right now you can't see it, but this, be able to see it. So this is the exterior. So this is the urine now passes from this pen you're seeing here, passes through my hand, which is our pseudo prostrate gland, and passes through the exterior. So you can see that these both of them are in serious relationship, and it's also in serious relationship with the bladder. So after the bladder you get the prostrate. Ureter passes through this prostrate. So this is why we have so many of these difficulties we encounter when the prostate becomes enlarged, like difficulty in passing urine and all the rest of them. We'll talk about that one later. Okay, so that is where the prostate is actually located. Now let's talk about this prostate that we're talking about that start causing some of the problems that we don't actually want. Okay, what actually is the function of this prostate? Is it that this prostate is just here, dormant, doing nothing, waiting to till old age to cause problem? No, the prostate is not just there waiting to cause problem. The prostate is actually performing a job that is actually very very vital for the male reproductive. Okay, it's actually very important for fertility itself. So for male fertility to be intact, the prostate plays a very significant role. Although we are not here to talk about male fertility, so we'll be concentrating on how you can actually survive prostate enlargement without side effects. I hope someone is listening. So one of the primary functions of the actually to add bulk to the semen. So you know semen consists of some fluids. So this prostate enlargement, prostate gland will release a fluid during ejaculation that forms the bulk of the semen, and one of these fluid is actually to form a medium that the sperm can actually move in to be able to survive the acidity of the vagina, to give the sperm a smooth sail. That is number one function of the prostate. Number two function of the prostate is that the prostate serves as a door between the place where urine flows out from, and between the place where urine flows out from and the place where sperm comes out from. Okay, some of us will be wondering, why is it that since the ureter serves as a gateway for both urine and both, why is it that you don't release sperm when you're urinating? And why is it that you don't release sperm when you're urinating, and when you're having sex, when you are releasing sperm, why is it that urine is not coming out with it? Have you asked yourself that question? So this is not happening because the prostate is actually playing a significant role that's actually making that not to happen. I don't know if you're getting me. The prostate is actually making what? Doing something very significant that is making this thing we are talking about not to happen. So look at the prostate. The prostate serves as a door. Okay, so when it's time for come out, I'm actually looking at a door here to be able to let you know what I'm talking about. So the semen the prostate stands as a door. So when sperm wants to pass, this door closes against urine, sperm will pass. When you want to urinate, it opens for urine to pass, and so that is one of the major functions of the prostate. The prostate also releases certain hormones that is very very important for male fertility. So you can see that this thing, you can see that the prostate has very significant role to play. Okay, so now prostate to become enlarged. The reason why prostate gets enlarged is what we don't have any medical answers to. So in medicine they say it's idiopathic, cause is unknown. So we have a lot of conditions, medical conditions that are actually idiopathic, and prostate enlargement is actually one of them. Having stated that, we now looked into this thing called prostate, and we found something that is common among everyone, or among that have prostate enlargement. So that there are factors associated with development of what prostate enlargement. And these factors, they are the things that we'll be discussing now. One of them is that it happens to male. It happens to men. Men are the ones that are actually what? Prone to developing. Meaning to say that a woman cannot and will not develop prostate enlargement. Okay, can you get what I'm saying? A woman cannot, because women, they do not have what? Prostate. But a man has what? Prostate. That is why prostate is actually what? More, it's actually a male issue. Just like a man cannot have fibroid no matter what happens. Same way, a woman cannot have prostate enlargement. Prostate enlargement affects men only. So, I don't know if you are together right now. So, having stated that, I want us to now move further to now look at. We've seen that there must be male. So another very important thing is that it is actually associated with age. Okay, if you're between age 20 to 35, 36, or even up to 40, you may not, or 30, let's say even up to 39, because I've seen people at 40 who have prostate enlargement. Okay, you may not really have any concern about that because about the do of thing, but from age 40 and above, a lot of people start developing prostate enlargement. And these days, even it is becoming more younger people are actually doing what? Developing prostate enlargement. The truth is that prostate enlargement can actually be preventable to an extent. About the prevention later. So, but now I'm just trying to make a foundation so we could actually talk about the treatment. So we've talked about that. So now, we've talked about being a male. So I'm saying that if you're from a family where your blood relation, someone who is related to you by blood, is having or has had prostate issue, it means that you also may actually come down with prostate issue. Then if you are obese, if you have certain ailments like diabetes, then you may actually be at risk of developing prostate enlargement. So now let's look at what are the signs and symptoms. What are you going to be seeing in someone, or what are you going to be feeling that you know that this is likely going to be prostate enlargement? One of it is dribbling of urine after urinating. You've gone to urinate. I actually tell people that your urine, that urinating moment is actually a very important moment. Immediately you clock 30 and above, because you need to start watching it from that time. So when you, after urinating, you discover that urine is actually dribbling. Like after urinating, you are trying to send it back, urine dribbles itself and comes out. Is actor that something is actually happening to the prostate. It's actually a symptom of prostate enlargement. Although all these symptoms I'm going to talk about, other sickness, other ailments can actually mimic them. Okay, it can actually mimic them. So that is why these are not just they are okay, you know them, and you want to be a good pointer for you to start seeking for help. But when you come to the hospital, there are things the doctor will do for you to be able to establish the fact that you have prostate enlargement. So another thing that will be happening is that you have this inability to urinate. So now, having come to this place, what is this prostate enlargement? This prostate enlargement is prostate that is very tiny, enlarges, becomes bigger than it's supposed to be. So when it becomes bigger, this is what passes the ureter that passes through this thing. When it becomes bigger, it will start obstructing the flow of what? Urine. So our second point is what? That this person may have inability to urinate. This person wants to go and pass urine, but this person cannot pass urine because the prostate is blocking where urine is supposed to come out. is that so big that the urine will now be struggling to come out. It's just like when you have somewhere that is leaking in your house and you use something to cover it. It's called that no matter how water struggles to pull over, it will be very water. This is the same thing that happens when someone has what? Prostate enlargement. This person may also have what we call incontinence. Incontinence is when you just stay and you start passing urine without having control over it. So this also happens. Okay, I've seen so many male who have this condition. Okay, then also urinating more than twice at night. You know, when you before now, we used to attribute frequency urinating at night to diabetes. So we now tell when someone now comes to us and tell us, okay, I urinated 3 times in the night, I urinated 4 times in the night. Most of us attribute it, or even like the teachings we've received, we like when someone comes up with that, it's like this person is having diabetes. But I want to give you a shocker. When someone actually urinates more than 3 times in the night, it's a sign that they have diabetes. When the prostate is enlarged or is getting enlarged, these things begin to happen. It may start from 2, it will be increasing gradually. So you don't just, if you're someone that has diabetes, you may conclude that it's one of the diabetic symptoms, not knowing that BPH have actually entered into it. Standing for prostate enlargement. So your doctor may actually be calling it benign prostate hypertrophy or hyperplasia. Okay, so prostate enlargement, all those rest of them. So that's what your doctor may actually decide to call it. So you now discover that this thing is actually doing what? Increasing. So we have other condition, even kidney stone can also give this. So that is why it's not enough for you to just sit down in your house and self-diagnose. You have to step out of your house. Some people will just, by the time they feel that, okay, I'm having frequency urination, I'm having painful urination, they go to Google and find out what is causing this. By when they see it, they feel like they've discovered what is wrong with them, and they start going on solution. They start asking, looking for drugs, all those internet vendors that sell drugs. They want to buy drugs for quick action and get, because most people are scared of coming to the hospital, most people are scared of going to the hospital. But moving your feet can actually do what? Save your life. So I'm trying to make sure that this video is as short as possible. So I'm trying to show this thing. Then by the time you see pain and blood in your urine, when you start seeing blood in your urine, it could actually mean that you're having prostate enlargement. This is also common with people that have kidney stone. So when you want to go and urinate, that is called that you're having delayed onset of urination. Like you are feeling pressed and you rush. So you go to the place where you now pass urine. You stand and this for a very long time, it's not coming out. It could be a sign that you are having prostate. Okay, and when it even start coming out, say it will be coming out before. It used to, when you come out to urinate, you urinate immediately and it will be rushing. But now you are out to urinate, it will be dribbling, coming out small. That could be a sign that you are having what? Prostate what? Enlargement. And you'll be like, you'll be straining that you want the urine to come out. That's why most of the time you see it's not that some people will go to urinate and some people will come out before them, especially those older men. So these are the things that happen, and sometimes we'll have this sudden, or you see someone that is just here laughing with people, discussing with people, and all the rest of them. Suddenly they have that urge to urinate and they rush out. And when they get to that place, they are not able to do what? To pass out that urine. So I've talked about urine, stream of urine not being strong, being weak. Okay. So now, how do you discover after seeing all these signs and symptoms? And I've told you that a lot of other sicknesses can actually mimic these things I've actually mentioned. So now, how do you know that what this person is having is prostate enlargement? The doctor is going to do something for you. Right in the doctor's office, he's going to do what they call digital rectal examination, where he will put his fingers into your anus. So with this, because of the position of the what do you call it, the prostate, he will be able to feel it with the hands. and he'll be able to know that something has actually been doing this because he has been trained to be able to do what, to identify that. So another thing that you're going to do, and you know that your prostate is enlarged, is when you do scan. Okay, so in Vignovus Medical Diagnostic Center, we have this month that we're entering into, the month of July, we have a special ultrasound section, the special prostate ultrasound we are doing for male above 40. So wherever you are, if you're within a boy state or around, and you are chanced, even from other states, you can come in for this investigation. So because one of the things I tell people that what they call it? That when you get diagnosed on time, early diagnosis can actually save your life. Look at what early diagnosis is going to do. It's going to save your life. You save money. Okay, if you don't want to waste money, it's actually you'll be ahead of anything. So if you're a man and you're above 40, and even if you're between 30 to 42, you can actually begin now to monitor yourself. And I advise people, once you clock 30, one of the tests that you need to be doing every year, please include, some people have medical people, we vary on our opinion about 30, so that you'll be on the wards, you'll be ahead. Okay, so we have that prostate scan. Then we also have PSA, where we are trying to make sure if someone has prostate enlargement, we are trying to make sure that this prostate enlargement is not cancerous. So now let's look at the treatment for the prostate enlargement. I know you're here because of treatment, yes, because you need something you're going to take to be able to flush out your system and let this thing be happening as it's supposed to happen, so you can be able to urinate. Because the truth is that if you don't treat prostate enlargement, it can cost you your life. I'm not a prophet of doom, but I've seen this thing play out. So when the prostate is having issues, it can affect and when the kidney function is being affected, the life of that person is in jeopardy. So now, what are the treatments? When you want to treat prostate enlargement, you need to watch out for lifestyle modifications. A lot of things they're going to adjust medically. You're going to adjust. You're going to have real adjustments medically. So, having said that, it will be done by you, and you're also going to take a lot of not a lot of medication. You're also going to take a lot. You're going to take medications. Okay, we can't rule out the place of medication in treatment of prostate. Then we also have surgery. So and we also have a lot of things. We also have a lot of things that you need to do to be able to overcome this condition. So how can you survive prostate? Now we've laid this foundation. How now do you survive prostate enlargement without side effects? One of it is early diagnosis. Okay, this is very, very important. I've talked about it. So early diagnosis and starting treatment on time. When we get diagnosed, we don't start treatment on time. We go for every other, most of us, because we still have little functionality, it's not disturbing us yet, most men don't take care of it. And it's also a known fact that women take care of their health more than male. Could that be the reason why we have more widows than we have widowers? To actually start up that argument. But I want us male to be able to take our health serious. Most of the time when men notice that they are having issues, especially when it pertaining to the prostate, they don't do anything about it until when it's getting late. When they are now retired, they now start becoming burden to their children or to their relatives. That's not going to be our portion, because we are learning stuff to be able to tackle this condition head on. So now we'll be looking at self-care. One of the things you have to do if you have prostate is to stay away from taking alcohol. Why did I say stay away from alcohol? Okay, and anything that contains caffeine, it's actually going to help you. Okay, this thing I'm telling you is scientifically proven, so you can Google it and you get the same answers I'm giving to you. So now, if you are drinking your water, you're taking fluid, you don't just take them at once, you space them. because it's this fluid that you're taking and other things you're taking that will actually definitely form the urine you're going to pass. So you're going to take water, but you're going to take little at a time. So now you're going to also be very careful when you are taking drugs for cold, because most of the drugs that we use for the treatment of cold can actually favor the enlargement of the prostate. So let's do that with what? With caution. So now it's actually very important that you exercise. Like recently, there's a recent awakening on exercise, and you can see the evidence with the videos and pictures people post online. It is called that people are now exercising. People are now exercising. So it's actually very important for male to work out. As you're chasing money, chase your health too. So create time for exercise, be it once a week or at least once a week. Have a regular time for exercise. This is going to keep your hormonal level intact, and it's going to help your prostate too to be in shape. So now another thing that you have to do is that you also have to reduce stress. Okay, you have to reduce stress. When you start getting older, then letting some things go, you also need to learn how to delegate. Okay, so having said that, we now come to the treatment of prostate enlargement proper. So earlier I talked about the treat what that if you're treating, you need to have what we call treatment goal. So now, what should be your goal? If you fix your mind on something, it's going to determine every other thing you're doing. So what is the treatment goal for prostate enlargement? One of the treatment goal is to relax the muscle around the prostate. The prostate is enlarged and is making is narrowing. The enlargement is that way for urine. So now you need, one of the goals you need is to do what? To relax the muscles around this prostate so that the urine can do what? Can flow. Two is to do what? Lower the level of the hormone. These are the goals. Lower the level of the hormones that can actually cause continuous increase of the prostate. Have another treatment, prevention of infection, and also another goal, prevention of infection and prevention of prostate cancer. So these are the goals of your treatment, and everything you're going to be doing while you're treating prostate enlargement should be able to address that. So now, how do you treat prostate? um, for you to treat prostate, you need to um, take most doctors will prescribe tamsulosin for people who have prostate enlargement. So what tamsulosin is going to do, relax, just like the first goal we talked about, relax that portion of the urinary tract, and to relax it so that urine can actually flow. So taking tamsulosin alone may not be able to give a lasting solution to that. That's why I keep taking tamsulosin, and at the end of the day, they may still need to do what? To be operated on to remove the prostate, because it's having effects on the relaxation, and this enlargement thing, they keep happening. So now we look at how do we now manage this condition holistically, especially when early stage. So now we have what we call a medication we call Prosclick. Okay, that medication is not actually here. It's here, but it's not handy right now. So this Prosclick has this functionality to actually dilate, that is to actually relax the muscle of the prostate. So it also helps the prostate not to also get enlarged. So it also works on the prostate muscles, making them do what? Shrink. So while you're doing this treatment, while you're doing all those things, we talked about prevention of infection. So that is where I don't know if you can say cystone comes in. So when you're taking cystone, cystone now encourages you to pass healthy amount of urine, to pass um, a, a healthy urine, okay, that contains the normal thing urine is supposed to contain, and it also has this effect on you from developing infection, because it is when you develop infection that you can actually have effects on your kidney. And we also have river alkaline water that will help your body to maintain homeostasis while this treatment is going on. So with this, the three combination of drugs I've talked about, it can actually help you handle this perfectly. Then if you want to really, one of the reasons why tamsulosin, one of the setbacks of tamsulosin is that it has this drowsy effect. That when you drink tamsulosin, you don't drive, and when you drive, you don't drink tamsulosin. So many men, because at that particular age, so many men may not have retired. So, and most of them will be skipping. They say it's usually at night. Most of them will be skipping those drugs. So we try to see a way we can actually strike a balance using river alkaline water, cystone, and prostate. So this combination gives us what we need. And the truth of the matter is that because we're looking at something that can cause side effects, the truth of this matter is that all these are just natural products that has been tested and proven over the years. Okay, it's not something that just tested now and you're the one testing it. Okay, so that is it. If by we actually encourage people to actually go through this treatment for 6 months, and after 6 months you discover that you're doing very well. That is how this thing works. So when you're treating kidney stone, I'm sorry, not kidney stone. When you're treating prostate enlargement, these are the medications that you need to take. Okay, so you be on the treatment for at least 3 months. You start seeing improvement. Then aside that, remember I told you that this treatment also you also have the exercise that you need to be doing. You also have the diet, the drugs. Okay, so now let me just, if you have prostate enlargement, it's actually very important for you to eat more of vegetable, reduce your consumption of red meat, eat more of plant proteins, and you see yourself doing well. So I will be organizing a special consultation, special coaching for the people that will be getting these products from me. So I'll be your coach. We'll go through this treatment together. And I have a testimony. I have testimonies already. Okay, and one of the testimonies actually came in this. Was it yesterday? I mean, the day before yesterday. So it actually came in recently. Okay, someone who has prostate enlargement of treatment. His one was just 1 month treatment that he did. Like I told you, for complete eradication is 3 months, but this man did for 1 month, and he went for test. And by the time he came out, he sent me the result. There was no prostate enlargement any longer. So what he will have to do is just to maintain what he did himself, maintain his health. So by the time you know he will increase in age and continue monitoring, so that whatever is happening, he'll be able to handle it before it gets dangerous. So when it gets so enlarged, so when the prostate gets so enlarged, it can actually obstruct the flow of urine totally. Like I said, it can actually lead to prostate can enlarge in a way that it becomes malignant, it becomes cancerous, and starts spreading. Okay, that's if it's not properly handled or if it's not handled at all. It could also affect the kidney, causing the kidneys to fail. And you know what the cost of dialysis is right now. It could also hit so hard on the bladder, and stones will begin to grow, okay, out continually. So this is what I said, let me share with you. I just hope you do enjoy this presentation. So in the group, we are going back to the group right now. So in the group, we'll be taking questions, we'll be taking answers, we'll be taking your orders, we'll be taking every other thing. So I want you to just stay put in this very, very place. If you're class, you can send me a message. You can drop a message in the comment section and tell me to add me to the group. So here we can actually have a one-on-one interaction, a robust conversation on how to actually survive this condition. Um, I'll be coming back again next week for us to be able to continue where we stopped. This is the end of the video. I am Honorable Victory, and I'm saying to you, thanks so much for watching. I am blessed because you watched. Thank everybody who commented both on the previous video, the previous live that was ended, so that we'll be able to have this. Then the starting was somehow rough, so but we tried to manage everything. I want to say thanks so much for joining. I love